Hello and welcome to MedSense, Sense Yourself. Today we will learn the procedures of phlebotomy. Phlebotomy is the surgical opening or puncture of a vein in order to withdraw blood. It is done when you go to any diagnostic center for any blood-related investigation like CBC, plasma glucose, serum electrolytes, etc. The person who does this procedures in a blood sample collection point is called the phlebotomist. Let's go straight to the procedure. After a proper hand wash, put on disposable gloves to protect yourself and the patient from any potential contamination. You also should brief the patient about what you're going to do.
Hello there. Today we are going to collect a small sample of your blood for a routine test. Don't worry, it's a quick and straightforward process.
Okay, I've never done this before. Is it going to hurt?
I understand your concerns. You might feel a slight pinch, similar to a tiny mosquito bite, but it'll be over very quickly.
Carefully select the site for blood collection, typically the antecubital vein or median cubital vein in the inner elbow. Apply a tourniquet above the chosen site to make the veins more visible and accessible. Use an alcohol swab to clean the site in a circular motion, starting from the center and moving outward. Then, allow it to air dry. With a sterile needle, puncture the vein at a slight angle. Ensure that you get a good flash of blood into the needle hub. This indicates successful entry into the vein. Gently withdraw the needle from the vein. Ask the patient to press over the area for a while. Remove the tourniquet to restore normal blood flow in the patient's arm. And then apply an adhesive bandage to the puncture site to stop any bleeding. Carefully place the used needle, gloves, and any other disposable items into the proper container to ensure safe and proper disposal. Always prioritize patient safety, follow aseptic techniques, and be mindful of infection control practices. Thanks for watching, stay safe and good day.